My name is Dr. Robert Patz. I'm an orthopedic surgeon at the New England Baptist Hospital. I specialize in shoulder and knee surgery. I have offices in Norwood, Milton, and Chestnut Hill. Tonight I'm going to talk about the diagnosis and treatment of osteoarthritis of the knee. It's a very interesting topic because there's a lot of information out there, both in the press and the internet, that confuses a lot of patients. So it's a conversation that I often have with my patients in the office, and now I'm getting the opportunity to give it to people out in the community. The most important symptom is pain that affects quality of life. And so it's very important when I speak to a patient to get an idea of how the condition is impacting their daily activities. Can they walk from the parking lot to a restaurant? Can they go to the grocery store and walk for half an hour? Can they be in the mall? Can they walk with their spouse? Those are the kind of questions that if patients answer no, then you can get an idea that perhaps they need some type of more aggressive treatment like a knee replacement. Usually patients come in for an evaluation and we ask them their symptoms, how the condition might affect their quality of life, and we examine them. Oftentimes we get x-rays and other tests, and depending on their symptoms and what the tests show, we will often institute a treatment program. And sometimes this will be non-surgical treatment, such as medication or therapy or injections. And then people that those treatments don't work and their quality of life is significantly diminished, sometimes we have to consider more aggressive treatment like a knee replacement. Patients have different expectations of knee arthritis and what the different treatment options are. There is a lot of technology available to us in terms of imaging, such as x-rays and MRIs and blood tests. But really, I think the most important part, once you've made the diagnosis, is to really delve into how the quality of life is impacted. And it's that quality of life being impacted negatively that really helps the patient and I make the decision together. There's a lot of technology available, but each surgeon usually utilizes a specific type of replacement based on his review of the literature and what's available. The recovery is usually there's 4 or 5 days in the hospital, and then the first 4 to 8 weeks are usually a little bit rougher. We often tell people that they could go back to work sometime between 4 and 8 or 10 weeks, depending on what they do. And usually the pain improves over the first year. And in terms of what you look for, in terms of a successful result, I like to tell people that if they can say, I feel much better than I did before the surgery and I'm happy I had it done, then that's a successful result. And that's what we look for in a knee replacement. It doesn't often give you an exactly normal feeling knee, but usually a much less painful, much better knee than you had beforehand. Double knee replacements, obviously if you're going to have both of your knees replaced, then doing them at the same time makes you only have one recovery, but it's a much tougher recovery. And some studies have shown that the rates of complications are higher in people going under both knee replacements at the same time. So from my perspective, patients with any type of medical problem or obesity or diabetes are probably not a great candidate. People that are very healthy, very thin, are people that we can discuss that option with. Otherwise, I think doing them in a staged manner, one after the other, is probably the better way to go. Recreational walking, maybe doubles tennis, some hiking, no high impact sports, no jumping, no jogging, no running. I try to get people to stay away from things like skiing, although I do have some patients that ski anyway. Normal expectation in terms of how long a knee replacement will last a particular individual would be approximately 15 or perhaps 20 years. In terms of the age of the patient when they have a knee replacement, we worry in a younger patient that they will live long enough that they'll wear out the knee and they'll need a second knee replacement. And at that point, the second knee replacement, the results aren't quite as good. The procedure is much more difficult to go through. And so it's ideal if somebody can wait until they're a little bit older so that hopefully they'll only need to undergo the procedure once in their lifetime. There's not an upper age limit, but certainly just like any type of procedure which you undergo general anesthesia, we don't want people over 80 having to undergo general anesthesia. However, there are many people in that age group, and I've certainly done this procedure in people in their 90s who have such poor quality of life, such daily debilitating pain. They're so, I use the word miserable, that the option of not doing it is not a great one for them, and we go ahead and proceed.